The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. My name is David Patzer, and I'm the managing partner at DKF Solutions Group. I'd like to welcome you to this morning's webinar on Cal OSHA's new emergency COVID-19 regulations. My co-presenter this morning is John Balestrini, president of the Bear Group Limited. Before we jump in, just a couple of administrative items. First, if you can assist me with a technology check just to make sure that the technology is working, I'd like to refer you to your GoToWebinar control panel. Down near the bottom, you're going to see a little drop-down arrow next to the word questions. If you can click on that and just send John and I a message that you can, one, see John's screen, two, that you can hear me. And John, if you'd like to say good morning.
Good morning, everybody.
So I am looking for someone just to let us know. Oh, Adam, thank you very much. Jessica, thank you so much. The other administrative item I'd like to address is we've got a lot of information to cover in the next hour. And so we're going to take questions and comments at the end, but it will be very helpful if as you have a question, a thought, or a comment, if you can go ahead and take a moment just to type it into that questions box, and we'll do our best to address all of the questions and comments at the end. Finally, we are recording this morning's webinar, and everybody who registered for the webinar will receive an email from me early next week with a view-on-demand link. So if you'd like to watch the webinar again or share it with a coworker or colleague, you'll have that resource to do so. So with that, let's go ahead and dive in. So before I turn it over to John, I do want to sort of set the stage of what we're here to talk about this morning. On November 30th, the California Office of Administrative Law approved Cal OSHA's emergency coronavirus prevention regulation. The purpose, excuse me, the purpose of the regulation is to protect workers from hazards related to COVID-19, and it became effective on November 30th, so it is effective right now, and it is in effect for 180 days. And John, I'm getting a little bit of lag here with you advancing through the slide. There we go. Now, as I mentioned, the regulation is in effect for 180 days, but the Office of Administrative Law, they have the option to extend the regulation for two 90-day periods. And this temporary regulation can become permanent if the board goes through the normal rulemaking process. Now, what the Office of Administrative Law did is they codified into CCR Title 8 sections 3205 through 3205.4. Now, today we're going to be talking exclusively on 3205, COVID-19 prevention. This regulation applies to everybody. There are just a few exceptions. So, for example, if you work completely alone and you never have any contact with any other human, whether they're a coworker, a vendor, a contractor, member of the public, or a customer, this would not apply to you. Now, 3205, as you're about to see, is a very big regulation with a lot of moving parts. We don't have time in 60 minutes to do a deep dive into the regulation. So what we're intending to do over the next hour is give you a summary of the different sections and call out very specific things that you really need to be aware of with this particular regulation. We're also going to strive to give you some insight into how to comply. And towards the end, we'll be sharing some compliance resources with you from Cal OSHA and the Barrett Group. And with that, John, I'd like to go ahead and turn it over to you.
Well, thanks. You know, nothing like a regulation being approved on the same day that they make it required. Well, my opinion is hopefully the 180 days is more than enough and we're through this by then. But in the meantime, we all have to develop and implement a program to keep our workers safe. Now, they give you the option to incorporate it into the injury and illness prevention program. I actually recommend making it standalone, but that is an option if that's the route you choose to go. So there are basically 11 required elements in the COVID prevention plan. And I'm going to go through each of them here, just kind of in brief, kind of hitting some of the highlights to, give you an idea of what's involved in it. And then at the end, I'm actually going to go through the program we put together and describe how I did it and how I organized it in order to make sense and make it something that we feel can be implemented simply. All right, so the first item is you need to have a system for communicating in place. Now, one of the key factors of this, it's bidirectional communication. Employees need to be able to report symptoms or hazards they find in the field. This is the key, and it's in the regulation at least a couple of places, without fear of reprisal. So you need to address that in your policy to say, hey, you can tell us about risks or your symptoms and we won't punish you for it. And then you have to have processes for dealing with higher risk individuals and information about testing, where you would send somebody to and the possible consequences of a positive test. Next item in the 11 is to identify and evaluate the COVID-19 hazards. This is a huge deal. It's critically important to make in the regulation to make the policy work. Additionally, employees themselves or their authorized representatives, meaning if they're a union, their union steward, can participate in identifying and evaluating the hazards, and they should, it be evaluated by you, the organization, and take action as needed. You need to have an employee screening program. Now, there's a couple of options for this. You, of course, can do where someone walks into work and someone puts the non-contact thermometer up to them and says, okay, your temperature's good. Do you have any of these symptoms? No. Or you can delegate that to the employees and say, hey, before you come to work, we need you to check your temperature and make sure you have none of these symptoms or don't come to work. You have to have procedures in place. This is the identify and evaluate to what you're going to do if somebody has it. So individual who COVID-19 case, what are we going to do to keep it from spreading in the organization? This is the big workplace specific assessment. You need to, the regs say you need to look at all workplaces in all employee, and I shouldn't say employee, I should say all human interactions to identify what the hazards are and how you can manage to prevent transmission to those. Indoor workspaces, if you have an HVAC system or access to outdoor air, you need to maximize the filtering and maximize the quantity of outdoor air blended in. That's in the regs to say that, because outdoor air is the most diluted from COVID, and it's the best stuff to breathe. It's the good stuff. You got to review and keep an eye on Cal OSHA and other health department, your local health department, CDC, CDPH. Make sure that you see regulations or guidance coming down the pike and you take action as needed to address those. You also have to look, as you put the program in place, what are you doing today and what do you need to do differently tomorrow to make it safer? And then you need to do those same inspections we did initially to identify the controls to put in place. We need to go back and look at it periodically to make sure it's actually working. So side note, and I know David has the regulation open, so I'm going to turn it to him. What is an exposure to COVID? How do we define that? Is it time-based, distance-based? What is it?
Thanks, John. Yes, in section 3205, they do define a COVID-19 exposure means being within 6 feet of a COVID-19 case for a cumulative total of 15 minutes or greater. And again, I want to stress that a cumulative total of 15 minutes or greater in any 24-hour period within or overlapping with the high-risk exposure period. Now, that brings us to another definition. What on earth is a high-risk exposure period? And 3205 defines a high-risk exposure period as one of the two following time periods. Now, if you have people who develop COVID-19 symptoms and you have an employee who was around them for 15 minutes or more cumulative in a 24-hour period, then from 2 days before they first developed symptoms until 10 days after symptoms first appeared, and 24 hours have passed with no fever, without the use of fever-reducing meds, and symptoms have improved, or the other high-risk exposure period is for persons who test positive but never develop COVID-19 symptoms. And the high-risk exposure period for those around those individuals is from 2 days before until 10 days after the specimen for their first positive test for COVID was collected. So we do have a time frame, but the time frame, again, 15 minutes cumulative in a 24-hour period, and it has to be around an individual who falls into one of the two high-risk exposure periods. And back to you, John.
It's complex, isn't it? So let's say we had an exposure. We need to investigate and respond to those things. And that's the third item of our 11. We need to have that procedure to look into what happened, why, and what can we do differently in order to limit it in the future. We should try to figure out as much as humanly possible the day and time the person with COVID or the person who's out was last at the work site, the date they had their test, all those factors, because they will come back and help us later when we're establishing how long people need to stay away. Then we need to look and figure out who got it, who was potentially infected, who had that exposure, 15 minutes or more cumulative in a day. This is a big deal now. Once we learn of a COVID exposure, we need to figure those things out and offer testing to anybody who is exposed within 1 day. So that's a pretty quick thing. And don't forget, we always have to do that, keeping HIPAA in mind. We can't, we have to keep privacy private. COVID testing for anybody who was exposed is at no cost to the employee, meaning that you or somebody else other than the employee has to pick up the tab, and they have to be allowed to do it during work hours. If their COVID exposure happened at work, the testing is on us. And then we have to look at, like I said, what kind of conditions we caused it, and can we change anything to make it safer later. So the next number 4 is we have to correct hazards. So we were already looking at the way things happen. We've looked at, whether, how COVID infections, exposures happen. We have to have policies for correcting it. An employee, remember, they have the right to tell you about a hazard. We have to correct it promptly. And we sequence the corrections based on the severity of the hazard. Obviously, we fix the worst ones first, or the biggest exposures first. You have to provide training to your employees on the policy itself, information regarding the COVID benefits which the employee is entitled. And those benefits, I'll get into them later, but are things from preserving seniority and other factors. So it's a big deal. How COVID spreads, methods of distancing 6 feet, and the importance of combining distancing and face coverings. These are in the regs because there's so many people who aren't doing those things. the particles and their travel distance. So you can get the idea that they want us to make sure that our employees are informed about what is going on, what COVID is, and how it can be spread. Here we are, 11 months into it, and we have people who don't understand it, and that's what is, we need to take care of. Face coverings and what the symptoms are. Obviously, if we're having them self-screen, they need to know what the symptoms are. Next thing we got to talk about, and this is one of the major changes between the lack of regulation prior and only the what's the word I'm looking for? The recommendations we had prior. Now it's rule. It used to be employees should stay separated by 6 feet. Now it's they must. So you as the employer need to keep your employees 6 feet apart. Now there are some exceptions where it's impossible when we're walking down the hallway and we, brush shoulders while we're both scrubbing the wall to stay away. Those are addressed as, something we want to avoid, but can happen. But we need to find ways to limit that. The official rule is everybody has to stay 6 feet apart at all times. Again, there are exceptions for everything. Face coverings, everybody's favorite, are required at this point. It's no longer recommended or encouraged. It is, you will wear a face mask over your nose and mouth, so no more chin diapers, when you're indoors and outdoors and less than 6 feet apart. Face shields, the plastic shields, I saw them a few months ago when I went into a Subway, which I haven't been back. They just had the face shield and no mask. Face shields are not a replacement. So if people, want to wear a face shield, fine, but they have to wear the mask as well. Again, there's exceptions. The biggest one is if you have your own office with a door and you can close it and you're by yourself, obviously you can take your face covering off. If you're in the lunchroom and you want to eat, as long as you're 6 feet apart, there's outside air supply has been maximized. You can pull the face mask off to eat or drink. Other engineering and administration controls. Well, let's say we can't get 6 feet apart between two people who work the front counter at something. We can instead put a solid partition that gives the equivalent of a 6 foot, call it breath separation, for lack of a better term. So you can use these.
John?
Yes, sir.
Yeah, I'm sorry to interrupt, but can you please go back to the last slide real quick? We got a couple of questions regarding face coverings. Last spring and over the summer, businesses, both public and private, they were really looking for a mandate from the state or federal government regarding face coverings, rather than leaving it to management decisions. We now have that mandate. Employers do not have a choice. This is the law now. Employees, if they're not able to maintain 6 feet separation, they are required to wear a face covering. Now, as John mentioned, there are some exceptions that John mentioned. When an employee is alone in the room while eating and drinking at the workplace, provided that employees are at least 6 feet apart and outside air is maximized into the area. Now, for those employees who have a condition that precludes them from wearing a face covering, Section 3205 does address that. Now, if you have an employee who can't wear a face covering due to a medical or a mental health condition or disability, they are allowed to wear a face shield, but it has to have a drape on the bottom, as long as their condition or disability will allow it. And any employee not wearing a face covering, face shield with a drape, or other effective alternative, such as a full-blown respirator, they have to be kept at least 6 feet apart from all other persons, unless that unmasked employee is tested at least twice weekly for COVID-19. Now, that being said, employers, you cannot use COVID-19 testing as an alternative to face coverings. But if you have an employee that they cannot wear a face covering, they cannot wear a face shield with a drape across the bottom, then they have to be kept at least 6 feet apart unless the unmasked employee is tested twice weekly for COVID-19. Thanks, John.
No problem. And I noticed a couple of questions that are right on this line. Carl asked, Can an employer mandate face coverings? Well, it's not the employer mandating it, it's the law. CDPH does provide some exceptions, or they itemize them out, so you can look into those to see if any of those apply. So yes, they can. As a high cubicle wall, can that be used as a partition? Depends on how high and whether it controls airflow, much like a partition would. So you'd have to look at each case separately. And no, a 3-sided cubicle is not a room. All right, so let's move on, because I know we have a ton to cover and I tend to be long-winded, which I apologize for. There's the barriers, which is between things if you can't keep the 6 feet. So the dividers to keep the, I call it the breath distance of greater than 6 feet. You're required in your HVAC system to maximize the quantity of outside air into your system, provided that the outside air index is not really horrible air, or there's some other hazard for employees, like you're in northern Alaska and it's minus 63. Sanitation, you need to look through your organization, your buildings, where you need to regularly clean and disinfect. And by regularly, I mean not only just before and after use by the employee, but have a scheduled cleaning time. Minimize sharing equipment, particular PPE should be next to 0. So there's a whole bunch more engineering controls. I'm gonna hit a couple more. Hand washing. One of the most powerful tools to avoiding getting sick is clean your hands and stop touching your face. So we want to encourage our employees and train them on how to wash properly. It's surprising how many people don't get that. PPE. You might need to consider using additional PPE depending on the direct COVID hazard that the employees are facing. So you can imagine that, you know, a worker in the field and an ER doc in the COVID ward don't have the same requirements. You have to look at the job and their exposure to that, whether or not they need actual respiratory protection. If there is no distance limits is something you can consider. Make sure OSHAs follow the regulations and whatnot. All right. There are specific reporting, record keeping, and access requirements. It's probably not too much you wouldn't expect, but you have to report cases to your local health department if they need it. If you have any serious illnesses or death, COVID serious illness or death, you need to record it to Cal OSHA, work-related ones, as though they were the same as any other work-related serious injury or death. So we need to report those as well. You need to record how you implemented your program. We put it live on December 12th. We trained the employees on December 14th using this computer-based training. We did this, that. You need to record those. They need to be documented and saved. Obviously, workers need to be able to get to the program. Any COVID cases, you need to keep track of all the details, their name, when they got it, if you know who they got it from or where they got it from, that information. But keep in mind, there's HIPAA ramifications here, so you can't just post that list publicly. So you need to keep that somewhat tight. Now, AB 685 has some big overlap and some things that David wants to cover that are a little on the scary side.
Thanks, John. Before I dive into that, just to quickly address a question from David. If physically distanced by 6 feet, can employees be in a room together without masks? And yes,
No.
Face coverings are required. Well, oh, I'm sorry, John. Please carry on.
No, I was going to say you I thought you said if they're indoors, they have to be wearing a mask. So if they're multiple,
Yes, if they are indoors, they have to be wearing masks unless they are eating and drinking, and they are 6 feet apart, and you have outdoor air maximized to the area that they're in. Is that your understanding as well, John?
Correct. So yeah, the question, if they're 6 feet apart, can they be without masks indoors? And the answer is unequivocally no. Again, there's a few exceptions, but mask.
Exactly. Okay, thanks, John. David, please let me know if that answered your question or not. And now let's dive into Assembly Bill 685, which was signed into law in September of this year. And I got a little bit of lag on your slide there, John.
Sorry, I see the.
There we go. Oh, no worries. So Assembly Bill 685, this has direct overlap with Section 3205, what we're talking about today. Now, what did Assembly Bill 685 change? Well, it changed a number of things. Employers are required to notify all employees at a work site of potential exposures, COVID-19 related benefits and protections that John will talk about in a little bit, and disinfection and safety measures that will be taken at the work site in response to the potential exposure. Employers are also required to notify public health agencies of all workplace outbreaks, which are defined as 3 or more confirmed COVID-19 cases among employees who live in different households within a 2-week period. Now, these last 2 bullets are particularly scary. From January 1st, 2021, which is when 685 goes into effect, until January 1st, 2023, OSHA can issue an order prohibiting use to shut down an entire work site or a specific work site area that they believe exposes employees to an imminent hazard related to COVID-19. And this last one is of particular interest to members of management who are in attendance. 685 made it much, much easier for OSHA to issue citations for serious violations. And they do not have to give employers the 15-day notice before issuance, which up until 685, they would have to do. So in other words, you can be issued a serious citation without a window that you can reasonably respond. Now, over on the right side of the slide in the orange box, this is how a serious violation is defined in the California Labor Code. Any employer who violates any occupational safety and health standard order or special order, and such violation is determined to be a serious violation, shall be assessed a civil penalty of up to $25,000 for each violation. And because of the extreme gravity of a serious violation, the base penalty is 18 grand. So at a minimum, if you get hit with a citation for failure to comply with any of the provisions of 685, many of which are in 3205, the base penalty is 18 grand. Now, OSHA each year, they publish a number of statistics, one of which being who they inspected and why, and what triggered the inspection. Now, these 4 reasons, they jockey for position a little bit each year, but they really don't change. The number 1 reason any employer, both public and private, can expect to receive a visit from OSHA is a complaint by one of your employees. And number 2 is after a serious accident or injury or illness. And just as a reminder, this year, the definition of a serious injury or illness was changed to mean any injury or illness occurring in a place of employment or in connection with any employment that requires any of the following: inpatient hospitalization for other than medical observation or testing, or in which an employee suffers an amputation, the loss of an eye, or any serious degree of permanent disfigurement. So the reason we wanted to bring this up is this is a regulation that has some particularly big teeth. And if you have some time on your hand and you're curious, Google OSHA enforcement and COVID, and you'll see a number of articles that will make it very clear very quickly that for OSHA enforcement right now, they are all about COVID. And that is something that employers need to be aware of. They're taking this very seriously, and employers do as well. And you see the other provisions and some definitions that are used in Assembly Bill 685 that you have in your handouts that I'm not going to get into now. And John, I'll kick it back to you.
All right. I noticed one question from Teresa wanting to make sure that everybody understands the indoor mask requirement. And I'm sure I'll beat this horse again a couple more times in a bit. But if you're indoors, you are required to wear a face covering at all times. That means if you're in a small office with 10 by 10 with 2 people, you wear the face mask. If you're in a 10 by 10 with no door, you wear the face mask. If you're in a 50 by 50 warehouse, you wear the face mask. The exceptions are itemized out very, very specifically. lunchrooms, 6 feet, only while you're eating, or in your own office with the door shut. So other than those few specific exceptions, if you're indoors, you'll need to wear a mask. All right, so I want to talk about exclusion of COVID cases. So if you have someone who has been exposed or tested positive, they need to basically leave the workplace. They need to go isolate. The isolation period is 14 days from their last known COVID exposure. This is good news for small organizations. Let's say you're a treatment plant, you have exactly one operator and the operator gets COVID. So you send them home. Well, now you're in violation. You got nothing, you can't do anything. Well, that could harm, oh wait, I skipped ahead. Apologies. Let's talk about this one. Then I'll talk about the next one. You need to, when they're excluded from COVID, you need to continue to maintain their earnings, seniority, and all other employee rights and benefits, including the right to their former job status as if they were never removed from their job. This is pretty important because it's itemized in the law, but it allows people to go home and know that they are secure. And it's written in a lot of detail in the regulation. I wanted to call your attention to this one, the 14 days. That's if you are exposed to a COVID case. There's a 14-day window of isolation or away from the workplace that we have to follow. I'll call back to that in a second. So return to work criteria. If you have COVID and you have symptoms, you can't return to work until 24 hours have passed since you had a fever without using fever medicine. Your symptoms have improved. They do provide an exclusion because your sense of smell and taste may not come back for a long time. So excluding those. And at least 10 days have passed since your test. If you never had symptoms, it's 10 days from the time they took your test. This is a big deal. A negative COVID test shall not be required for an employee to return to work. As long as they meet the criteria above, they can come back to work. Now you'll notice there's a difference between the 14 days if we're exposed, the 10 days after we tested. So keep that in mind. This is the one that I started to talk about on the previous slide. Go ahead, David.
Yeah, just to drive that point home, an employer cannot require a negative COVID-19 test for an employee to return to work. And back to you, John.
Okay, this is the one I started on. So this is the exception that's in the regulations. Imagine you're a small agency and you have one operator and they get COVID. Now you're in violation. If they were asymptomatic, you can call OSHA and say, hey, we have this situation that's critical to the community's health and safety. We need to have Timmy back at work. Yes, he's COVID positive, he's asymptomatic, and I can protect everybody else using whatever mechanisms are available to you at the time. So it allows you to continue to have someone who has been should otherwise be quarantined, have them come back in a very narrow bandwidth with OSHA's permission. So that's a huge, huge deal. So,
and John, just real quick, we got a question from Angela. How does evidence of receiving both vaccine doses impact return to work criteria? And I'd like your thoughts as well, John, but 3205 is silent on vaccination. I expect once the vaccine becomes widely available, guidance will be issued. Your thoughts, John?
I would expect the same. If they're vaccinated and an exposure, I would expect them to not be isolated. That's my opinion. That's not the way it is. However, if they test positive, the standard isolation periods, vaccine or not, are going to apply. We'll find out soon, hopefully real soon.
Yes. Okay, let's talk about some compliance resources that are available from OSHA. They did, at least in my opinion, a good job of getting some compliance resources up and available to employers very quickly. And there are 3 documents. If you Google OSHA publications, they'll be listed right at the top under latest updates and added publications. So on the next slide, you're going to see their frequently asked questions webpage. I'm not going to go through all of these. You have it in your handouts, and you can look it up on the web. But I do encourage everybody to go through that. It has a lot of really good information. And the previous slide will show a handout that provides a summary of what employers need to know about this particular regulation. Now, the next one I do want to slow down and spend a little bit more time on. OSHA developed a model COVID-19 prevention program that you can download as a Word document and you can tailor to yourself. Now, on the next slide, you're going to see that this model program template is essentially a fill in the blank, but I do urge caution here. Don't just fill in the blanks. Please read what each section is saying and really understand what your organization is committing to. As with all OSHA regs that require a written policy or procedure, if you put it on paper, you're going to be held accountable to it. So make sure that you understand what the language is committing your organization to doing. Now, on the next slide, we've gotten quite a few questions on this one. I received an email before the start of the webinar from Susan asking us to speak to this. And this is part of your exposure control plan that you have to develop. Employers are required to take a look at all the interactions your employees may have with other humans, not just co-workers, contractors, vendors, members of the public, customers that may be coming into your workplace, all of those interactions. And as you might imagine, that gets overwhelming really quickly. So what John and I would like to recommend you consider is think about human interactions in terms of categories. So I'm going to pass somebody in a hallway. I am outside, but I'm 6 feet apart. I'm outside less than 6 feet apart. If you start categorizing different ways humans interact, this is a much easier process to go through. Similarly, the regulation requires employers in your exposure control plan to take a look at each work area and identify possible means of transmission so that you can identify the controls that you can implement in that specific work area. Again, John and I are recommending that you can look at this in terms of Bob's office and Sue's office and the hallway in the admin building by the lab. Categorize the different work areas. You probably have single occupancy offices. You probably have shared offices. You probably have common areas. You probably have a lot of hallways. You probably have several restrooms. Once you have identified the categories of work areas you have that share the same space characteristics, then you can start identifying the controls for you to consider that may be applicable in each category. It'll make the process much easier and more manageable. And John, is there anything that you'd like to add to that?
Not that I'm going to cover more of pretty much the same thing at the end of my next section.
Got it.
So, all right. Okay, so I wanted to take the last few minutes. I know that we're kind of screaming up on the end, but I wanted to walk through how I put together our policy template. This is the master document we use. Then we'll talk briefly about our computer-based training module, the companion one that goes with it. So here is the table of contents, and this is kind of the meat and potatoes of the whole thing. This is the sequence we used. It follows the regulation mostly in sequence. It beats the regulation, but in sequence, although there's some variations in order to make it make sense when it's being implemented. So you got to have management approval, who reviews and approves it and is ultimately responsible. Why are you doing the policy? That's kind of an obvious one. One word, I can tell you why I'm doing the policy: COVID. But you need to itemize that out and explain to your workers. We want to do this to protect you and the public and to make sure we meet the spirit and the law of 3205. And then the compliance. This is a big deal. Who is responsible for what? I can have this great policy, but if I don't assign tasks or responsibilities, it's nobody's responsible. No one will do it. All right, the next section, and I'm going really quick here, so David, feel free to jump in if I miss something or don't get enough detail on it. But Communications is an important section because how are you going to tell your folks what they need to know? There's reporting requirements where you're able to report workplace hazards. The personnel must be able to report those hazards to you so you can take action on them. And again, in the regulation, without fear of reprisal. So that needs to be addressed. You need to say in your policy, we will not get even for you reporting something. Remember, confidentiality, HIPAA stuff. Don't get caught on that one. That could be ugly as well. COVID testing, you need to tell your folks about your testing, like where you would send them to get tests. It could be your standard medical provider. It might be the county's testing thing. Remember, the tests are on your dime, never the employees, or somebody's dime other than the employees. You need to tell them what triggers a test. That would be the exposure that David talked about a little while ago would be one. The consequences of a positive test, you could get sick, you could infect others. They need to understand these things. And then you need to tell your folks and contractors if they have been exposed within 1 day, all while maintaining confidentiality. So you can say somebody, and I'm not saying who, has COVID and you may have been exposed, but you can't say Jimmy has COVID again and you may have been exposed. It's important to maintain HIPAA privacy. All right, next section, employee identification and evaluation of COVID-19 hazards. You, as the agency, have to go looking for hazards that your employees could be exposed to. When you're doing this, you need to look for the hazard as though everybody is infected. Whether or not they really are, that's the way you look at the hazards. If everybody is here and everybody's infected, that's how you identify the hazard. So you're looking at all those places and times people may come in contact with one another. Whether you have, the delivery driver, the Amazon driver who comes to every place in the world 16 times a day at this point, those all have to be thought about. You need to regularly inspect work areas. So, just not when the program goes into place, but when the program goes into place and again later to make sure that you're staying on top of them. Employees and their authorized representatives, meaning if they're in a union, the union steward or somebody from the union, can also identify and submit hazards for correction, and you need to treat them and correct them as needed. Employees must be screened before coming into work. So you can have them self-screen. We talked about this briefly earlier. And then for every building, you need to address the quantity of outdoor air and increase filtration as much as possible, meaning MERV 13 or higher. There's other terms, that's the one measurement I know of. All right, these control measures, this is the section that talks about our controls, and physical distancing prior to OSHA's new rule by California was often employees, they oughta, it would be good if they would stay apart 6 feet. Now it's, they will stay apart 6 feet. Now there's some exceptions and you need to find the exceptions that would apply and include them in your plan. If we're walking across the hallway, I'm going to scrub my wall, you scrub your wall, we'll try to stay as far apart as possible, but it's probably not going to be 6 feet. That's momentary. So those are some of the exceptions. There's other ways to do distancing, and you need to address whether or not they'll work. Remote work, occupancy limits in a room. So you used to have 10 people in this room, you're now going to have 3. Add signs, floor markings to assist with physical distancing. If you have areas that get congested in the morning, you might stagger your work arrival. If you can't keep 6 feet, be as far apart as possible. But that doesn't say that you can say, I just can't be 6 feet, so I'm going to be, 5 is fine. There are very limited exceptions for that. Now, everybody's favorite is face coverings. You, as the agency, need to provide face coverings if necessary and make sure they're worn over the mouth and nose, so they have to wear them. They're indoors. Face coverings shall be worn at all times except when you're in a room by yourself, doors closed. When you're eating and drinking, and that was the 6-foot rule and the outside air rule that adds to that, there's an exception for people with hearing problems that need to see the lips moving, where you can use a face shield instead. Speaking of face shields, they are officially listed as not a replacement for face coverings. If someone says, I don't want to wear a mask, I'm going to wear a face shield, well, I'm sorry, you get to wear the face shield and the mask. There are exceptions. You can find them in there, and the CDPH has a list of exceptions that you can review to see if any will apply. Outdoors is a bit different. Anytime you can't maintain a 6-foot continuous separation, you're going to need to have the employees need to be wearing face masks. There are exceptions, just the other one. The CDPH has those examples of activities where a face mask may not be possible. It doesn't mean there's no controls for you. It means you have to deal with it a different way. If you have one of those different ways, there's a 2 times a week testing requirement for COVID, but you can't just say, skip the face masks and the physical distancing. We're just going to test twice a week. That's not an option. So it's only that limited set of cases. And then, of course, you have to go through your engineering controls, which are your physical controls. If you need people close together, they'll work in the front counter. You need to put in some sort of solid partition. You want to maximize the outside air. These are actually listed in the regulation. It's not us just being super cautious. This is the regulation. You need to have administrative controls as far as cleaning and sanitizing and limiting and controlling sharing, making sure that hand washing or sanitizer stations are available for everybody. And you need to look at all the activities and see if they need additional personal protective equipment as needed. The exclusion is part of the control measures, because if someone is infected or has been exposed, we need to kick them out of work. And I know there was a question on this. You need to maintain an employee's earning, seniority, and all of the employee rights and benefits related to their former job status as though they hadn't been removed. So essentially, we have to make them whole. It does say that you can utilize other, like your sick leave that was already available and other mechanisms to make them whole. So it's not just out of the general fund to make them whole. You can combine these other things. And like I said here, highlighted in yellow, they are complex. Review them closely. If you're not sure, legal counsel is the place to go. So let's talk about the hierarchy of controls. We use this in safety all the time. It says, hey, you're going to try to get rid of the hazard first and then find a different way to do it. And then an engineering control, administrative control, and then finally PPE. So in our safe work practices, we say we're going to follow that when deciding what to use for protection. We're going to address hygiene and work environment. These are general rules. This is how we behave at work, how we deal with these things. So it's our to-do list or our good to-do list. Here's the PPE rules we might have to put in place. They're in your safe work practices. Health screening is part of our safe work practices. Having employees stay home when sick, nothing fancy here. You have travel things, you might address those. Travel's scary right now. Exposure incidents. This is a big deal. You have 24 hours to let everybody know that they have been exposed. So if you learn that someone has been tested positive today, you have to figure out where they were for the 48 hours prior to being tested positive, which is the symptoms onset, which is the window which they begin to be contagious, where you haven't thrown them out yet and sent them home, and let everybody know they could have crossed paths with that they may be exposed. You got 1 day. Obviously, testing has to happen. If there's an exposure incident, these are keys that help prevent a further spread. Washing and sanitizing, getting everybody to wash their hands, not touch their face, taking the person who has been exposed and putting them separate, outdoors in a closed room, and sending everyone who's exposed home. And then obviously medical evaluation based on health department guidance. You need to look at any exposures and say, all right, what happened and why, and take corrective actions to try and minimize the opportunities for that same one to happen again later. Return to work. We need to tell everybody that there's certain policies and procedures they have to follow to come back, to come back to work. There's 2 more big ones. These are the ones that we're not really covering today, but there's 2 classifications that have additional rules. If the health department calls you up and says, hey, you're a site of a multi-COVID outbreak or a major outbreak, you need to refer to these 2 sections, because there's additional things you'll need to do. And they're based if you have a whole bunch of people at once. I apologize, I'm still screaming through this. Please include your questions. Investigating cases, you want to collect information. You want to track the test results, the symptoms onset date, the day and time at the workplace. All these factors will help you decide who else may have been exposed, and probably more important for continuity of operations, who has not been exposed and can remain working, which is in many cases incredibly critical. You need to correct those COVID hazards. 3205C4 says you're going to correct the hazards, do them in the order of most severe to least severe. Now we're at the big boy, return to work criteria. If you're a case with symptoms, you have the 24-hour no fever, no drugs. Symptoms have improved, excepting for those taste and smell, and the 10 days. If you tested positive but never developed symptoms, it's just 10 days since your test. Here is the big one. Negative tests cannot be used as a mechanism to bring them back to work. You can't say you're staying out till you have a negative test. If they meet the upper two criteria by the health department, they can come back to work. You can't require that test. In this, I talked about this one earlier, but this is that wiggle room you have. If you have that critical employee who has to be there and they happen to be asymptomatic, you can add systems in to allow them to come back, protections, but they need to be, it needs to be OSHA approved. You actually contact OSHA for that permission. What we did to help make the understanding when to come back to work easier, we put together scenarios. We used the CDC ones and then added a couple of our own. If you're confirmed or presumed positive COVID case with symptoms, there's your criteria for returning to work. Once you have met those, you can come back to work. And there's different scenarios for if your family members are sick, your exclusion window when it starts, the 10 or 14 days start. So it gets kind of complex. We used a scenario-based thing to make it easy to understand. You need to train your employees on the plan itself, the risks of COVID, the status of the outbreak in your neck of the woods, which right now in the whole US, it's ugly. And then any job-specific safety and health practices needed in order to be safe. And they actually, in the regulation, delineate out a lot of very specific things. There's record-keeping requirements and reporting requirements, of course. And we have our computer-based training that goes along with it. David?
Thanks, John. So part of the deal, the Barrett Group, the package that they've put together is developing an exposure control plan that is in compliance with 3205 and a companion customized computer-based training module. If your organization currently uses Target Solutions, we can add it to your account. If you're a My Safety Officer subscriber, we can put it on your My Safety Officer webpage. If you have neither, then the Barrett Group can provide you with the raw file that you can host on your own organization servers, and it will run on any major web browser. Now, we did have a couple of questions. Earlier this year, the Barrett Group developed exposure control plans for a handful of cities and special districts in California based on guidance and recommendations from the CDC, the World Health Organization, OSHA, OSHA, and the Water Environment Federation. Those documents were put together long before Cal OSHA had begun even contemplating 3205. So if you have an earlier exposure control plan that the Barrett Group developed for you or that you developed in-house, it is likely not in compliance. So I do encourage you, take a look at your exposure control plan and compare it to the 11 required elements in 3205. And that will point out specifically where what you have may or may not be in compliance with section 3205. Now, this brings me to another aspect of compliance assistance. The Barrett Group can develop your exposure control plan to the newest version. If they developed your plan last spring, before 3205 was even thought about, they can update it with for $1,000 with some editing conditions. If you would like to have a exposure control plan developed from scratch, and then if you are a CSRMA member, the member discount price is $2,900. And if you're a My Safety Officer subscriber, it is $2,900. If you don't fall into either of those categories, then it's $3,900 for both the exposure control plan and companion training module. If you have any questions on that, you can either reach out to John or myself. And just to one last thing, the exposure control plans that the Barrett Group develops are applicable to everybody except those departments that your organization may have that are already subject to Cal OSHA's aerosol transmissible disease regulation. Those individuals will be your emergency first responders, such as police, fire, paramedics, healthcare individuals, or individuals in your within a city department that work with high-risk populations and are subject to Cal OSHA's aerosol transmissible reg. So with that, we've been doing our best to stay up on the questions as they've been coming in, and it's been fantastic. You have you've had a lot of questions, so that's great. In the time that we have remaining, John, I think let's go back through and make sure that we've done our best to address them. I will say this, just as a reminder, we did record this morning's webinar, and everybody who registered for it will get an email from me either before the end of this week or Monday of next week with a view on demand link. So you'll have this to watch again. Additionally, we did send the handouts for this presentation out this morning, but from the questions, there's a number of people who didn't receive them. If that's the case, please email me and I'll make sure that you get a copy of the handouts. So with that, John, I'm going to go back up to some of the questions that I don't think we may have addressed. Let's see, Carl, you had a question regarding what action is necessary to allow someone to work, and I believe John covered that. Carl had another question, can an employer mandate face coverings? It's not the employer mandating them now, it is Cal OSHA. So the answer is yes. And John, I'd like you to weigh in on this one. Is a cubicle with high partition walls considered an office? We're also well more than 6 feet apart.
No, office is a separate closed space.
Excellent. Okay, next question. From Tom, is a 3-sided cubicle considered a room, or does it have to be a floor to ceiling sided room with a door?
Yes, the door. It's floor to ceiling, 4 walls and a door and a roof.
Got it. Okay, we have another question. Do you know where we can find HVAC guidelines?
Not really. The regulation says you need to improve the filtering as much as your system will allow. So it's kind of system dependent, which means if you can increase the filtering to, I know there's different measurement specs, but MERV 13 or higher, they expect you to do that. If its system won't support that, then you do it as much as you can. And the second factor is you include as much outside air blended in as your system will allow. So it's really on a system by system basis. You're supposed to maximize those 2 factors.
Thank you. And Siana, hopefully I pronounced your name correctly. Can 3205 leave run concurrently with LA City and state COVID paid leave? I'm going to be very careful here. Neither John nor myself are labor attorneys, so I encourage you to consult with your HR and the city's legal counsel on that. The state of California has put out guidelines for how to run different leaves concurrently. And if you would like, drop me an email and I'll point you to those resources. Let's see, David, I think we addressed your questions. Jody has a question. Does an exposure occur if masks are worn within the 6 feet? And again, according to the definitions, I'm just going to reiterate this. That in 3205, a COVID-19 exposure means being within 6 feet of a COVID-19 case for a cumulative total of 15 minutes or more in any 24-hour period. And this definition applies regardless of the use of face coverings. Okay, moving on here. Let's see, Charles, you had a comment. Federal law gave the employee 80 hours pay. Is this new law unlimited, say for multiple or successive exposures? And I apologize, but rather than give you incorrect information, I'm going to have to punt on that, and I will refer you to your HR or your organization's legal counsel. There are a lot of moving parts in this regulation that dovetail into very specific labor laws, and that was one of the concerns the business community had with the draft regulation. Some of those issues are going to be evolving, but if your organization has access to a labor attorney, this is a perfect question to put to them. Let's see. Shannon has a question. Is a sneeze guard considered equivalent to a solid barrier?
It really depends on how big the sneeze guard is. Is it effectively reducing the, as I called it earlier, the breath distance, or is it just to catch the splatter? So if it's a 2x2 sheet of plastic, I would strongly argue, no, it's not a barrier. If it's, 3 or 4 feet wide and 6 feet tall, I would argue that it probably is, depending on the airflow in the room itself. So it really becomes a case-by-case basis.
Got it. Ed has a question. If you have to have 2 or more employees share a vehicle, is it okay if the employer requires masks and have them open windows for ventilation?
In a vehicle, you're within 6 feet. So, and I would actually argue you're indoors, so you would need to have the masks on no matter what.
Exactly.
So I don't think that to me, it's pretty clear on that one.
Got it. We had a handful of other questions that were related to leaves. And again, I would refer anyone who has a question on how the benefits will work, including leaves. I encourage you talk to a labor attorney or your agency's legal counsel. And the last question we have here, not the last one. Heidi has a question for you, John. Slide 33 states you must be cleared by a medical professional or HR once meeting the criteria before returning to work. But slide 18 does not state that you have to have a medical clearance. Can you clarify that?
If you meet the return to work criteria as outlined, you can come back. I believe there are ways that you can get a medical clearance in advance. I apologize for not being completely clear on that. But the OSHA rule is if you meet that criteria, you can come back.
And our last question, we got one more. David has a question. Can security guards screen employees entering the facility? My thoughts on that is yes, as long as it's done in accordance with the in-person screening guidelines that are outlined in 3205. Your thoughts, John?
Absolutely. I mean, when you go to, Kaiser Hospital, they have a station set out front where they check your temperature and ask you. So there's no reason not to. Remember, there are privacy implications that security guard would need to understand. In addition to, it has to be a non-contact thermometer. CDC, in fact, has a web app that you use prior to showing up, where you, I guess it doesn't do the temperature, but it does all the rest of the questions, and you have to show the results page to security as you go in. So short of being a labor attorney and, attorney general, I would answer that I think it would be totally fine.
And Tony has a question. Are masks required to be N95? My thoughts on that, John, are no, unless that is, unless respiratory protection is otherwise necessary.
I agree.
Your thoughts?
I agree. It actually says cloth face coverings. If you read the regs, it describes what qualifies as a mask. I wish we all had easy access to N95s, but it is just cloth face masks, and they do describe them in more detail.
Thanks, John. And Isabel, this will be our last question. I see we are running over the 11 o'clock time, and I do want to respect everybody's schedules. Isabel has a question. How long will this be in effect for? This is an emergency regulation that is in effect for 180 days or 6 months. But the Office of Administrative Law, they have the authority to extend this regulations for up to 2 additional 90-day periods. Now, how long this remains in effect, in my opinion, has everything to do with how quickly the vaccine can be rolled out and the number of positive cases in the state and their impact on ICUs around the state. I did see that there are a couple of cities that announced today that their local hospitals, their ICUs are completely full. So how long this remains in effect, 60 days, 180 days, plus an additional 90 or plus an additional 180, it has yet to be seen. That said, I do encourage all of you, as I mentioned, the overlap with 685 makes it much easier for OSHA to issue a serious citation for non-compliance with the elements of 685, many of which are in 3205. And because it is would be classified potentially as a serious violation, the penalty starts at $18,000 per violation up to $25,000 per. So I do encourage everyone to take this seriously, not just from a regulatory compliance standpoint, but also from a workplace and public health and safety standpoint as well. With that, I do want to say thank you to everybody who made time in their schedule to attend today. We didn't give folks much advance notice of this webinar, but it was very well attended. We know everybody's schedule is all over the board because of the pandemic. So thank you for your time. John, I want to thank you as well. Once again, as a reminder, you will receive an email from me with a view on demand link for this session. So while we did go very quickly through the material, you'll have an opportunity to view it at a much more leisurely pace. With that, I wish everybody a fantastic and safe day. Thanks everyone.
Everybody. Hey, we did that in song. Have a good day, everyone. I appreciate it. Stay safe.